I'm Dr. Claudia Cotca from the Washington Institute for Dentistry and Laser Surgery. Recently, in an editorial with New Beauty magazine, I mentioned one of the things that we can do to actually improve our oral health is to make sure that we have fresh breath. Of course, no one wants to have bad breath, and perhaps it makes us a little bit weary about communication and being in close proximity with others, and certainly can affect our comfort level. But most importantly, don't forget about your health, your oral health, and overall systemic health. The products that I use at home, which are research-based, and of course I also recommend to my patients, really classify in two different categories. One product line really helps me obtain nutritional value for my teeth, and that is fluoride-based. And the other category really focuses on revitalizing the tissues and the system locally. So that's also mint-based or other types of essential oils which help to revitalize the gums and help to keep things fresh, and most particularly helps to keep whatever I've enjoyed over my breakfast, lunch, or dinner off of my teeth. The one thing that I like to use at home at least once a month is a fluoride-based prescription grade, either Floridex or the Clean Pro 5000 from 3M. The most important thing to remember about the fact that these products do have fluoride, which are prescription grade, is that they have additional elements like calcium phosphate and potassium nitrate. The other thing that I have used for a very long time, and I really have applied it in my difficult cases as well as my very healthy cases, and of course I use it on myself, is the tooth and gum tonic. Is it exceptionally simple to use, is quite effective, and certainly it has been used in research studies, but one thing I love about it is that it does not have alcohol. At home, I also like to use an over-the-counter product called ACT. I don't prescribe the formula which includes the alcohol, so make sure that you read on the back of the bottle whether or not it has alcohol in the active as well as in the inactive ingredient label section. And of course, at the office, I implement two different ways to revitalize the tooth structure, particularly after a cleaning. And that is, of course, an oral rinse that has fluoride grade prescription, as well as a film. And this comes from 3M. It's a varnish type, and it's a little bit thicker and sits nicely on the tooth structure, therefore allowing for the tooth to absorb more of the nutrients. Of course, for any further questions, don't hesitate to contact us at www.dclaserdentist.com.